All right, so I'm going to do female reproductive anatomy today. Somebody asked me to review this stuff again. We did it in class once, but like I said, it was on the last test, and I wasn't super pleased with how people did. So it's going to be on the final. So if you already know that, you're in good shape. But we're going to be talking about the various parts of the female reproductive anatomy today. The genital tract, which includes the ovaries, oviduct, the uterus, the cervix, and the vagina. And then you have the external genitals, which are also referred to as the vulva, which include the labia majora, labia minora, mons pubis, and clitoris. So just a little bit more detail, labia majora are these two folds of external skin on the outermost part of the vulva. You also have the labia minora, which are internal to that, and they contain the openings to the urethra and to the vagina itself. You also, superior to that, or anterior, I guess you could also say, you have the mons pubis, which is the skin covered in coarse hair. You could think of that as just being above the vulva. And you also have the clitoris, which is this erectile organ. It's the site of intense sexual feeling. And if you remember, like we talked about in class, some cultures engage in this female genital mutilation whereby part or all of the clitoris is removed. So here's a picture of the vulva. This whole region here is the vulva, and it does not include the mons pubis. But you can see the anterior-most part of the vulva is the clitoris, that's the region of intense stimulation, intense feeling. And the outside-most part here is the labia majora. Internal to that, or just inside of that, you have the labia minora, or minora. And then you have the opening to the vagina here, as well as the opening to, of the urethra here, just anterior to the opening of the vagina. All right, so I would definitely know pubis, or mons pubis, I would know clitoris. This says urethral meatus, but you can just think of this as the opening of the urethra. I would know labia majora, I would know labia minora, and I would know that this is the opening to the vagina here. So moving on to sort of the more internal anatomy, the genital tract, you have the ovaries, which are producing eggs and sex hormones, like we talked about in that last section. The oviducts, which are also called the fallopian tubes. That's how I learned them, as fallopian tubes. But you can call them oviducts, you can call them fallopian tubes, you can call them whatever you want. Well, as long as it's correct. And those actually move eggs to the normal site of fertilization within the uterus. Then you have the uterus, which is the site of implantation and fetal development. That's actually where pregnancy occurs. You have fertilization happening in the oviducts. And then once that implants into the uterus, that's when the pregnancy actually begins. You have the cervix, which is sort of the superior most part of the vagina. It's the top part of the vagina, and that's the opening from the vagina into the uterus. And this can dilate during childbirth so that the kid can get out. And then you have the vagina itself, which is the birth canal and copulatory organ of a female. So here's this picture of this woman who's just kind of been cut in half. And you can see the uterine tube, or the fallopian tube here, that's sort of got these fimbriae on the end, connected up to the ovary. It's not connected, but it's nearby the ovary. And you'll remember that when an egg bursts out of the ovary, these fimbriae, these finger-like projections, actually sweep it into the uterine tube, where it may encounter a sperm. If it encounters a sperm, it travels down through the uterine tube and implants itself down here in the uterus. Here is your uterus. Sort of following this down, you get to the cervix, which is the top part of the vagina. That's the cervix here, and then you keep going and you wind up, here is the vagina itself. Okay, there is the vagina, and then outside of that, like we talked about in the last slide, you have the clitoris, the labia majora, the labia minora, and the vaginal orifice itself. Next to the vaginal orifice, you have the urethra and the urethra opening, which of course connect up here to the urinary bladder. So here's the urinary bladder, here is the urethral opening. It is adjacent to the vagina itself, but definitely not the same thing as the vagina. These are two separate openings. And then this is just looking, so if you look back here, you've got the ovary, you've got the fallopian tube right here. This is just looking at a closer up view of that. So I just wanted to make very clear, here are your ovaries, right? This one's been cut in half so you can see what it looks like on the inside. And this is, the egg is going to burst out of here or here. It's going to be swept up by those fimbriae into the fallopian tubes, where it's ultimately going to implant in the uterus. Okay, so the cervix would be this part up here, the very top part of the vagina. And that, like I said, this is going to be on the test, probably in a diagram that looks very much like this one. So you should know that this is sort of the cervix, this is the uterus, these are those fallopian tubes, and then these white things here are the ovaries themselves.